Of life in the public option. Remember the government-run health insurance plan championed by progressive Democrats? It couldn't muster enough votes to make it into the final health care law, but Democrats now have a new approach. They say it'll help trim the deficit to the tune of $68 billion. There's a look at the national debt. Congresswoman Jan Schakowsky, Democrat from Illinois, is among the Democrats taking the lead, pushing this bill. Congresswoman, how did you come up with this number, $68 billion?
Oh, it's not our number. It's the number of the Congressional Budget Office, who all along has been the entity that's been scoring, that is counting how much money is spent or saved. So it's the official estimate of how much it would save.
You know, Republicans and a good number of Democrats were opposed to this public option the last time around. So how do you go about selling it? Because there was talk even then about how much the public option would save.
Well, actually, the House passed a version of the public option, and we think the time is different now because of the great concern about the budget deficit. I actually serve on the President's Commission on Fiscal Responsibility and Reform. Some call it the Deficit or the Debt Commission. Well, we're looking for every way that we can to save money. This having a not-for-profit government-run option, a choice, well, just one choice to compete with the health insurance companies, we think is a way to really bring down the cost of all health care, not just when people pick the public option, but it'll serve as a kind of anchor that'll compete with these private companies. And what do you think the impact
will be on the private companies? Because there are those who say it doesn't just compete with them, it puts them out of business.
Oh, that's ridiculous. Of course, that we saw right now that United Healthcare just had an increase of 31% in its profits. At the same time, less money was dedicated to actually providing health care. We're seeing insurance companies jack up their rates, jack up their profits, but not necessarily serve more people or actually devote more money to health care. So what we're seeing is that the insurance companies are actually helping us pass this bill because we can't trust them to do the right thing, and having some competition will be a good thing.
Congresswoman, it's good to see you today. Thank you very much for explaining it.
Appreciate it.